Hello, and thank you for joining me. Today we're going to be covering a really important and hot topic both for patients and doctors, the controversy surrounding chronic Lyme disease. Now, as we're looking at that, I recommend you pause and take the time to read our disclaimer, but we're going to jump right into the information here. And right on Medscape, which is a common, publication about doctors and mainly doctors read, but this is called the Lyme culture test and it causing an uproar. And this is really where Dr. Birascano is talking about a brand new blood test. Now, Dr. Joseph Birascano is one of the leaders in Lyme disease and teaching patients about chronic Lyme disease. He's really champion in the area. And he's working with a team to develop a new blood test that keeps the Lyme alive for 8 weeks once it's taken out of the body. And here's why. When Lyme disease is used in is taken out of the body, it changes shapes. Here on this image, let me show you. As the blood comes out in the dark field microscope, you can see the spirochete. You'll see here this squiggly-like line, a corkscrew organism, which is the spirochete. And what's happening here is, as soon as it leaves the body or the deer or the animal or whatever, because it's a symbiotic organism, it changes shape. It goes into hiding. So if you do this, only about 40% of the patients can you see it in the initial taking the blood out of the body and putting it on under the microscope with a silver nitrite stain. And this is the way to do it. This is the best clinical way to do it. The problem is it can go dormant for 8 weeks and hide inside cells and intracellular and be very hard to find. And they are developing a blood test, a serology, to keep the blood alive to do that. Now that's exciting, but in addition to that, on the same platform, we see CDC. And we see Barbara Johnson, PhD from CDC, really giving doctors strict guidelines, what to look for. Here she's talking about make sure you have the symptoms, the patients are right in the right geography, they have the right behaviors around Lyme disease. And when you do that, make sure you're first providing a two-step process, testing first for the ELISA and then for the Western blot. So let me show you why there's some problems with that clinically, and this could be very helpful for doctors and patients. So Dr. Birascano and his team that's researching, trying to work with this blood test, they really, and as a clinician, you can see dark field is the best form of diagnosis, but it can go in dormancy for 8 weeks, so it's not visible for every patient. And CDC is saying, let's make sure we have the symptoms, behaviors in place. So when we take a deeper look at the CDC recommendation, what we typically see here is that the rash isn't present in most patients. About 25 to 50% might see the rash, most do not. And when the tick bites you, it gives you kind of an anesthetic feeling, so you can't really sense that you were even bitten. That's one problem. Secondly, Lyme disease is far beyond just the New England states or the East Coast. It is all over the US, all over Canada. It's not just in one central region. So that doesn't help us making sure that people are in the right geography, because Lyme is everywhere, Canada, US. And then the third one is they're recommending you use an ELISA and a Western blot, which is okay. But what about with the patients who are very ill and their immune system is too weak? These are immune system tests. They require an immunoassay. They require the immune system to respond. If someone's too weak or on medications or steroids because they've been diagnosed with another disease or being symptomatically treated, like for fibromyalgia or another disease like that, then they will not respond. They'll get a false negative. So this is really important. And the bottom line is you're going to make sure that for the patient to get the correct diagnosis, the right testing is done. Because if you seek, what can happen here is the doctor can take these symptoms and go boom, right into fibromyalgia, lupus, rheumatoid arthritis, and you see painkillers, antidepressants, anti-inflammatory. These are a big Band-Aid approach. I mean, they're helpful for patients temporarily, but long-term, they're not really resolving the problem. If, in fact, the patient has Lyme disease complex, I want to make this clear. They have multiple infections. They may have Borrelia, other co-infections, viruses, parasites. Their immune system is going to be down, and they need to be treated for these infections. In addition, in just clinical experience and over a decade of us working with chronic Lyme disease patients, about 80% of people that come in with fibromyalgia, rheumatoid arthritis, lupus, autoimmune diseases have these infections, and they may also have chemical and heavy metal toxins. So this is important because if we take a look at fibromyalgia here on this slide and look at the keynotes of it, the symptoms for fibromyalgia and Lyme disease truly overlap. They're overlapping all over the place. And in fact, Lyme disease has many, many, many more symptoms, and it's known as the great mimicker. It can mimic something like 300 different diseases. And so classically can fit that. And if we do a Google search and we look at what are the potential causes for fibromyalgia syndrome, you'll find illness, hormones, trauma, stress, but really that doesn't tell us anything because we see that typically with every chronic Lyme disease patients. They have an infectious origins, their hormones, nervous system is thrown off, and typically, these affect everything neuroendocrine in the body, anything related to nerves, anything related to hormonal system. Again, digestive symptoms. Patients can also have memory loss, short-term memory loss, joint pain, all these things, insomnia, depression, all of these classic symptoms we see in fibromyalgia patients. And I hope that this presentation was helpful because the goal here is for people to get a better diagnosis. And we're encouraging doctors and patients alike to make sure that they're working with the doctors who are trained, they're at least Lyme literate, to look deeper. Because if you just look at what CDC is saying, you could be left with the wrong diagnosis. And in addition to that, get the wrong treatment, which you never get to resolve what's really causing the problem. So it's important to get the right diagnosis and then on top of that, the right treatment plan. Now, treatment is a whole different category, but it needs to be done properly. Just diagnosing it doesn't make it very easy to treat. Chronic Lyme disease can be very difficult to treat, particularly the Lyme disease complex of all the infections and chemical toxins. You need, in my opinion, a very strong integrative approach. I hope this was helpful. God bless you. Please pass this information along to people who may have fibromyalgia, autoimmune diseases, or Lyme disease, because education really is the best prescription. And that way we can help people look at options to getting well.